Hello future doctors, welcome back to the Happy Teeth Club. Please subscribe the channel and hit on the notification bell. Also, like to comment and share this lecture with your friends. Today we are discussing about an important syndrome that is orofacial digital syndrome. As the name says, it is made up of three components: oral components, facial components and digital components. In oral cavity, teeth and mouth and tongue involved. Cleft lip, cleft palate, ankyloglossia, and missing teeth. In oral cavity, we can see a tongue with unusual lobed shape and growth of non-cancerous nodules on the tongue, as we can see in the figure. Some people have bands of extra tissues, that is hyperplastic frenula. So in this figure, we can see cleft lip, cleft palate, missing tooth, and ankyloglossia. In face, lip, nose, and eyes are involved. We can see cleft lip, flat nasal bridge, and hypertelorism. So hypertelorism is widely spaced eyes, as we can see in the figure. Abnormalities of digits can affect both the fingers and toes in people with orofacial digital syndrome. These abnormalities include syndactyly, that is, fusion of certain fingers, brachydactyly, shorter than usual fingers, clinodactyly, that is curved finger, and polydactyly, that is presence of extra digits. All we can see in the figure. Thank you.